Hello, I'm Maria Garcia, a licensed massage and bodywork therapist, owner of the private practice, Mobile Healing, and Mikubi's Boutique. Today I'm going to talk a little bit about the modalities that I offer, and I'm also going to talk about a few pre-curated treatments that I have made for you. I do offer hopefully this video can help you, but I do offer consultations. I offer, so the first consultation is free for all first-time clients, and after that is $35 for a 30-minute consultation. But if you get a membership, you get free consultations. At least you get 2 a month. Okay. So the consultation will help you, pick a modality. And I will also let you know what supportive therapies are needed to deal with your neuromuscular needs, as well as self-care. So we're going to start with prenatal. Prenatal is pretty self-explanatory. It's for people that are pregnant. I do require for you to at least be in your second trimester. And the areas that we skip while you're not, obviously you're not ready to go into labor is going to be all the trigger points around the heel and the ankle. Right? And we got sports massage. So any of my massages can be customized depending on your needs, but I do have 2 that are already pre-curated. So I have a pre-event, and that's called Revive and Awaken, and that's before you do an event, and you need your muscles reinvigorating and feeling good and pliable and flexible for whatever sports events that you're going to be doing. And then we have a post-event, and that's going to help you treat all the malice and the stress and the soreness and even injuries if you ended up having injuries after your event. And it's going to be neuromuscular injuries, not of course I'm not going to treat you if you have broken something, like if you broke a bone or something. I can't treat you for that, just for your neuromuscular injuries. And deep tissue is kind of my specialty. I kind of do have a heavier hand. Doesn't mean I can't adjust, but deep tissue is highly recommended for people who do have the tolerance, have a higher pain tolerance, and experience deeper soreness from either working out, or maybe they have some type of diagnosis such as fibromyalgia or scoliosis or something, and they just prefer heavier pressure. And I also do go for trigger points when I'm doing a deep tissue. If you don't like it, but most people, they want me to work out their trigger points and their knots and everything. Swedish is pretty much your basic massage. It's a very relaxing massage, very light, medium pressure, and I have a pre-curated treatment for that as well, and that one is called Lavender Love. So what I do is, obviously we're going to use lavender all over the body, and there'll be hot towels, there'll be hot stones, and there'll also be a lavender face mask as well at the end. And that's a 90-minute treatment. Really good for relaxation, for pampering yourself. And we have lymphatic drainage. Lymphatic drainage is, most people who get lymphatic drainage are trying to treat something. So a lot of the ladies that I see for lymphatic drainage have had they've had some type of cosmetic surgery, breast implants, tummy tucks, and in order for them to recover from the surgery, they need lymphatic drainage. Another thing is, if anybody has any type of inflammation around the legs, be it for diabetes or whatever reason, they might have a medical reason that they have a lot of, some people even they'll get parasites and they have to take medication, and the medication will get them inflamed. So then they have to, so most people, it's rare that a person just do it, for no reason. Most of the time it's because they're trying to treat something. Even people who struggle with weight loss, that might be carrying a lot of extra weight, they'll even, and a lot of times, I can't tell you what to do in this aspect, but some doctors and I myself would recommend that if a doctor says it's safe for you to take a diuretic when you are trying to lose water weight. And there could be different reasons for that too. All right, and we have oncology massage, and that is going to be for cancer patients. So there's a lot of contraindications, things we can't go near, people that aren't having the massage done for any particular reason. They're not trying to treat their, any neuromuscular issues. They're probably, some of them might be at the end of their days and they're just looking for that comforting touch. Some people, mostly that's what it is. It's about comforting touch. And not everybody's in terminal. Some people are recovering and they just want some relaxation. So I'm pretty much certified to be able to stay away from the areas and understand the contraindications and everything. So that's what oncology massage. And I've had the pleasure of working with cancer survivors as well. It's a very wonderful experience, a very strong people. Next we have geriatric, which is also people that are, well of age. I would consider geriatric over like 70, and it's usually not going to be very hard. Usually the older people get, the thinner their skin gets, so you're not going to want to be doing any abrupt movements on them. It's usually a very gentle massage, also just providing comfort. And some people might also have cancer, so then it would be a combination. Child massage is it's not technically a modality, but it is something that I have made. The child sessions are 1 hour, and it involves a consultation with the parent, obviously, and they're to treat like childhood discomforts, such as growing pains. The legs might hurt, the hips might hurt on girls and boys who are growing. A lot of babies, small babies, infants struggle with tummy aches, and a lot of that might be constipation. It could be colic, it could be air. So I could treat that, teach the parent. I want the parent to be there so they can learn and do this for their child as well, because sometimes these discomforts that these kids have, they don't, they're very regular while they're still growing, so they might last a few months. So maybe the parent doesn't have the time or the money to be taking them to me and spending $100 for an hour session every single time. So I would rather the parent be there and get the most knowledge, and then just come to me when it's, when they really need the extra hand. But yeah, so I'll teach the parents how to massage the belly of the child, and how to move the legs and massage the legs in order to get, some bowel movements and some gas to be removed from the body, and also to massage the child in areas that might be hurting due to them growing. So that is the child massage. Like I said, it is not a modality. It's just a massage that I wanted to make for kids. Kids are important to me. I have 3 of them. Love kids. Kids are the future. All right, next is also injury and clinical massage. So I do have a 30-minute injury massage, and that's for those of you who don't really like massages, but you guys have something that you need to work on. So it could be like you got in a car accident and you have whiplash, but you don't like massages. So you could just come in for 30 minutes. I'll work on your whiplash, and that's it. This is not a thorough massage, but it does include supportive therapy. So if you're on my table and you come in and you're like, my low back hurts, I have a video showing my low back treatment, so I'm going to do that treatment on you. But this is specifically to treat an injury or an ailment. That's exactly what that's for. Okay. You can have longer sessions. You can have an hour session of treatment. Some people have paid for a full hour because they didn't want 30 minutes, but it was going to take 45 minutes. So you have the 30-minute injury care, or you have the hour. I don't take 30 minutes for relaxation or anything like that. You have to have something going on for me to take the 30-minute and do the injury care. The curated treatments that I made, some of them are beauty treatments. The main beauty treatment was Brighten My Day, and that's a vitamin C treatment. I will use a vitamin C scrub on you, and that's going to help with any hyperpigmentation. You'll also get a face mask. All right, and so next is, I think I talked about most of them. The smooth and silky, and that's another beauty treatment, and that is pretty much to help treat and like cellulite, essentially. So I use collagen on the face, and I use coffee scrub on the body, and then we end it with shea butter and cocoa butter. And so if you do, and that's the consultations. I also have some spiritual gifts. I am a light worker, so I'm aware of the spiritual beings around us, and if you have any messages as well. So one of those people love talking to me, and sometimes people would just start texting me for like hours. And sometimes people will just call me and they'll be on the phone with me for hours, and I'm like, I try not, like, I don't want to be rude to my clients or anything like that, but because it is a need that I have seen in people to talk to me both about their spiritual situations or talk to me about their neuromuscular, that is why I put these consultations there. And you'll get a lot more of it because of the discounts and the things that I offer complimentary for memberships. You will get more out of that. But pretty much, I think I covered everything. As always, you can leave me a comment. You can hit me up on my social medias. But yeah, I hope that you learned something.